Hi, I'm Justin Riley. Today on Wisconsin Doctors, hand care. Taking care of our hands is so important because we all use and sometimes, unfortunately, abuse our hands. But we're on location at Fort HealthCare at the Center for Hand Care in Fort Atkinson to find out how we can take better care of our hands and, more importantly, if we're experiencing chronic problems, what we can do about it. My guests will include Dr. James Bruno, orthopedic surgeon here at the Center for Hand Care, and Ann Coots, occupational therapist and certified hand therapist. It's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We are on location at the Center for Hand Care here at Fort HealthCare in Fort Atkinson, and I'm really excited because we're talking hand therapy today. And I've got a great team in front of me. This is Dr. James Bruno, who's an orthopedic surgeon at the Center for Hand Care, and Ann Coots, occupational therapist and certified hand therapist. Wow, what a title.
Thank you.
Very cool. Good to have you with us today. Thanks for having us here. So, Ann, I'm going to start with you. Why don't you tell us a little bit about Fort HealthCare's Center for Hand Care?
Well, it's a team collaboration that exists of the surgeon, the nurse, the occupational therapist, and the certified hand therapist, and the patient working together to come up with a plan that's effective and quick and efficient. It's a one-stop shop, which is really nice. You can come in and see Dr. Bruno, you can see a hand therapist, occupational therapist, see the nurse, get your treatment, effectively and quickly. I think we are a specialty, so it helps us come up with a good diagnosis and come to a conclusion of what the patient needs a little faster than maybe someone who has to spend time, going to different doctor. Fort HealthCare is really blessed to have 4 certified hand therapists to serve Jefferson County area and 8 OTs that treat upper extremities and treat patients. And I think it makes us the best in the regional care that we have.
That's such a fascinating topic, is hand therapy, and I think a lot of folks don't even realize that it's out there and available to them. So I'm really excited to talk about that today for sure.
And I think this is worth taking pause and talking about it because hand therapy really isn't like your standard physical therapy. It's a different division that has dedication and of course has a lot of experience with that. Maybe you could elaborate a little bit for people that aren't too familiar about what sets hand therapy aside from your general physical therapy.
Sure. Well, it's kind of an art and a science of evaluating and treating injuries and conditions of like the shoulder through the hand. Hand therapists use a number of therapeutic interventions to help the person return to their highest level of function, and they specialize in that area of the body and the hand.
Absolutely. And you guys have a pretty good team of 4 different hand therapists from what I understand here.
Yes.
So who are the hand therapists here at Fort HealthCare and what sets them apart in your opinion from other folks?
Well, the hand therapists here are licensed and registered occupational therapists who have, through advanced study and expertise, are specializing in this. You have to practice for at least 5 years. So we have OTs in our system that are also treating hands, but they're training to be certified hand therapists. We have one here now that's going to take a test this fall. And the 4 that are here are Kelly Brunson and myself and Sarah Wild, and then Laura Nyquist at Whitewater. Okay. So we have the other sites that also have certified hand therapists.
So there's different folks at each site then? Okay, great.
And I did want to add one little dimension to that. With hand injuries, timeliness is very important, and this staff does make themselves available. We can't always wait even a week to get certain therapies started to restore full function to a hand. So I think that's an element that maybe gets overlooked. People can't come 3 weeks out with an injury to a tendon and expect the best result. So these people are really on top of it, and I've seen excellent dedication to what they do they'll come to me with questions so that the patient gets the right thing done the first time.
I think that's huge, and I think maybe that's something that people should take note of, is that, you know, if you experience a hand injury, I mean, time is of the essence.
Absolutely.
You really need to get in and see someone fast, and Fort Healthcare seems like that's the place to do it, because you guys make yourselves readily available, and you know how to counsel people into knowing what the next steps are. So, yeah. Really quick before we go, we just have a few seconds on this first segment here, but I'm going to ask real quickly, what can hand therapists do for patients?
Well, I think they kind of, what Dr. Bruno alluded to, they can bridge the gap in the medical management of the case. So let's say they do have a tendon repair, or they have a crush injury, or they have a fracture. Sometimes it's managing it skillfully, knowing what we should do next. Should we move it? Should we not move it? Should we mobilize it? Should we splint it? Should we do modalities? Should we do? And it's an art. It really is an art and a science. And then talking to the doctor closely is so helpful, because we are certified hand therapists. We can talk to the surgeons and get their input and have a good plan.
Yeah,
So
having that team approach again is so
right.
huge. We got to take
Right.
a short break. When we come back, we're going to continue talking hand therapy here at Fort Healthcare. Stick around. Welcome back to Wisconsin Doctors. We are at the Center for Hand Care here at Fort Healthcare, and I'm really excited because we're talking hand therapy today, and now, if you can see, we've got some toys up here on the table, so that's always going to be a good segment. And I'm talking with Dr. James Bruno and Ann Coots, who both work here at the Center for Hand Care. And I want to just jump in real quick, because during the break, we were talking a little bit about how a hand therapist can really be a guide for patients. Can you talk a little bit about what that means?
Sure, this is a great point. Again, hand therapy is a little bit more complicated, and along the way, the person would need frequent visits with that therapist, and the guide portion of it is the patient gets reassured along the way, this is what to expect at that point. Yes, you're doing fine, or no, you're a little bit stiff, we need to move you more aggressively. Because a person doesn't necessarily understand how things really should play out when they've had either hand surgery or a hand injury. And that's what one of their functions is. It may not be recognized. They really guide them through the process, reduce their stress, and take the complexity and just give them a simple set of reliable, concrete steps that we're going to follow to get them back to function.
Sure. So they have it laid out for them. There's no question, in other words. So that's great.
And I think that may be a point worth emphasizing too, that again, that the teamwork where we have this communication, and maybe Ann, you could tell the viewers a little bit about how we work together.
Sure.
Yeah, go ahead.
Sure. What we usually do is, typical hand treatment, what we would normally do first is like assess the patient. So Dr. Bruno would refer the patient to us to do an assessment. And we're usually looking at like their strength, we're looking at their scar tissue, and 'cause that's a big thing in hand therapy, what scars will do to tendons or do to joints. And so being on top of that, look at their pain level, assess that, look at their stiffness, and their sensation. And then the typical treatments, we would work on strengthening if they're weak, and then with the scar, we would do soft tissue mobilizations and often give them silicone pads. You order those a lot for a scar. For heat or ice, we could do paraffin bath treatments. Fluto Therapy, it's a machine that patients love it. It usually feels sort of like a warm sand you put your hand in, but it desensitizes a sensitive scar, it brings down swelling, helps with range of motion. So if I have a real stiff hand that doesn't want to make a fist, put them in that for 15 minutes, do some massage. Usually can promote more motion. We have modalities we do: ultrasound, iontophoresis, electrical stim, arthritis. There's a lot detailed.
That's a laundry list of treatments.
Yes. And then I know we wanted to talk a little bit about CMC arthritis. And you were going to talk about typically what we would do in that process together.
Yeah, go for it. Go for it. I'm just going to sit back here and just listen to these guys talk for a while. So
It's a fancy name to talk about CMC arthritis, but carpal metacarpal arthritis, basically, the layman's term would be pain at the base of the thumb.
Okay.
Now, sometimes those people would be assessed by our therapist first, and they would develop a treatment protocol, and maybe it comes to resolution, the person's happy, they go on their way. If they run into a snag where they're not getting better despite a reasonable amount of treatment time and all of the interventions that Ann mentioned before, they would then send the patient to me, Dr. Bruno, anything else additional we can do for this patient? And that can range from injections of cortisone in the joint, even to surgical interventions. And again, for each of these steps, there's an entire protocol worked out in advance, so they just follow that process straight on through. So a typical patient, on the other end, I might see first, you know, Mrs. Jones, you don't need any surgery. Why don't we just try therapy first? We're always going to try the least aggressive, and I'll call it the least scary option for the patient first, provided it's reasonable, and see if they get a satisfactory result. And then if that doesn't work, then we just sort of amp up the treatment to the next level. Might be therapy first, then it might be an injection. And the person's quality of life is still very poor because of ongoing pain, sleepless nights, inability to open jars, all of those things that can come with this arthritis at the base of the thumb. Maybe they're a surgical candidate. And again, that's all worked out. The communication piece, I did want to circle back a little bit to talk about that, because I think this is what's really unique. I've worked at a lot of places. I've been in upstate New York, I've been in Milwaukee, I've been out here. And the communication piece, I think, is very unique here. Most of the hand therapists are right in the same building with me. They will literally walk, or we have electronic medical records, it works beautifully. They just send me an email basically, Mrs. Jones needs this, what do you think? They will also walk over. They will also walk the patient over. They will also walk me over to look at get my eyes on the patient. And this is one of the greatest things, because it means so much. You know, when you have the experience of these therapists, I've been doing this for 25 years now, just to look at a situation. And it's more than you can communicate in a text. And another thing that's unique is where the patients get their hand therapy, there's a big picture window. And every time I'm going to refresh my coffee, I look in and see who's in there, and I'll circle in, hey, how are you doing? Are you coming back? So I mean, there's really that constant, very hands-on, and I think that's one of the unique features.
We want to hear more about this, but we got to take a short break. We'll be right back here at Fort HealthCare talking hand therapy. Don't go away. And welcome back to Wisconsin Doctors. We're here on location at Fort HealthCare, and we're at the Center for Hand Care. And I'm really excited because we're talking hand therapy. This is such a fascinating topic, and I've got a great couple of folks here talking to me about it today. It's Dr. James Bruno, orthopedic surgeon, and Ann Coots, occupational therapist and certified hand therapist. So I got to know this. What are some of the more common conditions you treat at the Center for Hand Care?
Sure. Just to give you almost a laundry list, things like carpal tunnel, hand numbness, trigger fingers that get stuck, tendon lacerations, your hand gets cut, get those tendons sewed back together, wrist arthritis, we do various fusions or releases around the wrist, meniscal tears within the wrist. There's a little cartilage inside the wrist that's just like a knee meniscus that can be painful and popping, fractures of the wrist, arthritis of the hand, arthritis of the fingers. So all the maladies basically of the hand and wrist area are typical things that we would take care of and have this coordinated care for.
Yeah, absolutely. That is quite the laundry list for sure.
Yeah.
So what are common symptoms or dysfunctions that patients experience before coming to the Center for Hand Care?
Oh, very good. Okay, so how could a person self-identify?
Right,
I have a problem that maybe they can help me with. Say for carpal tunnel, a person might be concerned that they're waking up at night, that their hand is asleep and they have to shake their hand out. It might be that the hands are very stiff or the wrist is painful. Steering your car, opening a door, the wrist feels like it's going to give way and you just don't have any strength left. You have difficulty opening a jar because there's pain at the base of the thumb and your hand just doesn't function well. A lot of times people get so far down the line the hand's not functional where they're having difficulty doing their, what we call ADLs or activities of daily living, buttoning their shirt, opening a jar, doing housework, those kinds of things.
Sure. Now these things it seems to me like they're, because I've experienced those things from time to time. I'll fall asleep on my hand and my hand can't feel it when I wake up or something like that. So that's not necessarily, if people have experienced that a couple of times, or that's not necessarily something that they would need to come and see you for. But if it's frequent, it sounds like that would be a reason why they would need to come and see you.
Yeah, that's a great point. Not every little ache and pain needs attention, but the persistent ones that are causing that dysfunction.
Yeah, absolutely. So what are the advantages of treatment to receiving care at your center? What are some of the advantages of coming to see you guys? Because you guys are specialists. What are some of the advantages?
The advantage I would list is one, availability to take care of these problems. Two, forethought about what are the diagnoses we're going to see and how do we best take care of that person to give them a reliable result and a time-efficient result. We want to minimize visits, we want to minimize surgical interventions if we can, we want to minimize expense, all while attempting to maximize the quality for them. I think experience is one of the advantages. Again, the certified hand therapists have been doing this for years. They've been through a rigorous program. They can pick up problems and identify them. They have great personalities. They have the great bedside manner of dealing with people. Again, being that guide to get them through that process. Final one, I think, is location. If you're in southeastern Wisconsin, we're centrally located. It's access. We've got the hand therapists at 3 different clinics now, I believe. And they're available to see people. So those are a few of the advantages I could see.
Yeah, and location is huge, I think, for a lot of folks. I mean, and this location really allows for easy access for lots of different folks, whether they're coming from Milwaukee or Madison or right here in Fort Atkinson or the surrounding area. It allows for ease of access of this kind of care. Do you guys typically see people from all around, or is it pretty well centralized?
We'll get referrals from people who maybe went to a surgeon in Milwaukee or Madison and had a hand surgery, but they need a certified hand therapist to do the treatment. So they will look for us. We're on a list because we're on a American Association of Certified Hand Therapists. There's a website, and they can look up, the doctors know where we are, and they will send them to us. And then people come to see Dr. Bruno because he used to practice in Milwaukee, so they will come and follow you because they were your patient over in Oconomowoc. So
excellent.
So we do.
Excellent. That's great. Well, we got to take another break here, but we'll come back and we'll continue talking hand therapy here at Fort HealthCare. We'll be right back with more Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at the Center for Hand Care, part of Fort HealthCare, and we're talking hand therapy today. This is kind of under the umbrella of orthopedics. So, and my guests include Dr. James Bruno and Ann Coots. And I want to ask a little bit about the scheduling process, because a lot of folks, when they are hearing this, they might think, well, a lot of the things that you're talking about is me, it describes me to a T. How easy is it to get in to see you guys?
I think because we are a more rural location, it is easier to get in. I have a friend that was trying to get into therapy in Janesville area, and he had to wait 3 weeks, where here we should get you in sooner than a 3-week time frame, usually. So usually the first step is to, sometimes people see their family doctor and they get a referral for therapy, and they'll come to see us through that venue, and they would just call, or their family doctor would refer them and get the appointment set up. Another option is to come see Dr. Bruno first, get a referral to Orthopedic Associates, and just come into the ortho front desk and ask or call them and get scheduled. And then if Dr. Bruno thinks therapy is appropriate, he would refer. And he has a real nice staff right up front that sit as you exit, that can schedule right away as you walk out, so then you don't have to call or make it yourself. It's all taken care of for you, and it's pretty seamless.
And I think that's a great point, really, to make, because medicine is very confusing. There's specialists this, specialists that, clinics here, clinics there. Who do I call? When do I call them? And when they leave the office, they have a plan. They cannot exit the office without going past our front desk. And there's friendly people there that, oh, I see they want you to get a hand therapy, and they will set those appointments up for you in consultation with you when it's a convenient time for you, and all follow-up appointments, so that they take away some of the busy work for the patient. They just they're along as the patient and don't have to worry about the logistical elements.
No wild goose chases here. In
Correct.
Words, so, yeah, absolutely. So if somebody wants to schedule an appointment, will they see you? I mean, if they want to schedule an appointment at the Center for Hand Care, will they see Dr. Bruno?
There's a couple entry points. Sometimes, as Ann mentioned, it's a primary care referral. They'll see their doctor. I've got this problem. That doctor can generate a referral, and then we schedule the patient. They can see me. They're not seeing residents or PAs for the hand. They're seeing the surgeon, the doctor, when they come to see me. Another entry portal is through the therapist. Sometimes they'll be sent there maybe by the primary care, or maybe even make their own phone call there and they assess that, and they, if need be, doesn't always need to be done, but they can refer that patient to me. So there's
Done that.
several access points for people.
I'm curious to know, I mean, it sounds to me like you guys really have it together, obviously. So there's got to be some really great success stories that you have. Any come to mind, success stories of people who you thought people thought they'd never be able to use their hand again, and then, all of a sudden, maybe not all of a sudden, but gradually they realized that they, restored full functionality. Can you think of anything like that?
Sure, this is a great question.
Yeah.
A success story, generically, is anyone that's happy and has a functional hand.
Yeah.
So there's a lot of those people.
Yeah.
What makes it great is when you look at a situation and say, ooh, this is a challenging situation.
Yeah.
Are they going to be okay? So the kinds of things that we'll look back at are the ones that look troubling.
Right.
Ooh, the stars aren't lined up too well here.
Right.
An example would be a fellow who elsewhere had a couple attempts to repair extensor tendon laceration, didn't heal for whatever reason. We went and just brought it for him and reconstructed that. Third time a surgery, and he got great function on the hand, took care of all the stiffness. Another one was a roofer, cut his thumb on a table saw, and this guy needs a powerful grip. He's up on roofs, and you looked at that hand, it's like, I don't know. And we were able to repair the tendon, restore motion to that, and he's back working full employment. So it's those kinds of things. They're very gratifying for us to see that, because that's like the fruits of our labor, that, hey, they did okay.
Yeah.
I had a patient recently that he referred to me that had sprained a small tendon muscle in his finger, and it made it hard to grip, and it made him hard to grip a golf club. And he was a golfer, he was retired, wanted to get back to golfing. And in 4 visits, we got him better, got his range back to normal, got his strength back to normal, and he was a happy camper because he could get back to what he wanted to do, which was golfing. So
That's fantastic. We are out of time. I can't believe it. I feel like we just got started, but we're out of time. Dr. Bruno and Ann Coots, thank you so much for joining us today. And it was great talking with you.
great.
Absolute pleasure. Thank you.
We've been talking hand therapy here at Fort HealthCare. From all of us here at Channel 57, we're reminding you to live longer, live better. We'll see you next time.